Hello, I'm Dr. Greg Forrest, a board-certified chiropractic neurologist, certified in applied herbal sciences and acupuncture. Trained through the Autism Research Institute, I'm a registered Defeat Autism Now doctor and clinic director of the Pain and Brain Healing Center in Blaine, Minnesota. I'm also author of the best-selling book, Why We Hurt and How We Heal. And it's an international bestseller, and it's one book that I really recommend if you want to pursue the road to real healing. Also, I'm an international lecturer, and I get many questions from doctors and the public as to what is a biomedical care program and how does it work. Well, it's a science-based metabolic approach to treatment for a wide variety of health problems. Everyone now agrees that drugs generally do not heal these modern chronic health complaints. They simply reduce or eliminate some of the symptoms. A better choice is to address the underlying nutritional and metabolic issues that arise. The guiding principle to a biomedical approach is simple. Remove what is causing harm, restore what is missing, and assist in repair of what has been damaged. Often there is exaggerated response to specific foods, airborne allergens, toxic chemicals, toxic metals in your environment that need to be identified and removed through specialized laboratory testing. Usually there are decreased levels or genetically increased need for various nutrients, vitamins, minerals, digestive enzymes, antioxidants, essential fatty acids that must be restored, need to be identified, specific to you through laboratory testing, and then restored. All to assist in repair of the metabolic dysfunction and damaged tissues. Care at my clinic is different. I utilize a step-by-step approach to promote real healing in your body. First, specific laboratory tests through blood, urine, and stool are performed to rule out any frank pathology and then to provide vital clues on what road to take to optimize body and brain health. Second, diet is primary. We always need to look to the diet. Usually the diet is improved along with specific dietary restrictions. Dietary goals are established for the reduction of chemical exposure and through the removal of sugar, artificial sweeteners, preservatives, and food additives, processed foods, and the addition then of more whole foods, organic foods, are utilized. Adverse reactions to certain foods such as casein and dairy and gluten that can act like opioid acting peptides called exorphins are identified and removed if necessary. Specific laboratory IgG food allergy tests, ELISA IgG blood tests, are utilized many times to identify hidden allergies. The body will respond through IgE antibodies immediately. You'll know if you're reacting to, say, a strawberry and your throat swells up. But the IgG food antibodies take anywhere from 12 hours to 3 days to form, so you may not know that a day ago or 2 days ago that food you were eating were causing the symptoms today. So this is identified through an ELISA IgG food allergy test. Once identified, the problems can be easily removed from your diet. It is vital to identify any problem with maldigestion, malabsorption, and dysbiosis through specific laboratory tests such as a comprehensive digestive stool analysis and a urinary organic acid profile. Once digestive problems specific to you have been properly identified, they can be improved. Many times this involves overcoming the challenge of imbalanced gut bacteria. Your actual intestinal tract harbors about 4 to 6 pounds of bacteria. That is if you're healthy. Good bacteria. But in today's environment with so much antibiotic use, chemicals that are coming in through our food, we're finding that the good bacteria are being killed off and bad things can grow. Candida albicans, Clostridia, different bacteria that really shouldn't be there are growing, and this is creating what's called a dysbiosis, meaning unhealthy life. And the intestines are the root to your health in your life, because where you extract the necessary nutrients from your food. So if you're having dysbiosis, this can create very commonly gut issues, irritable bowel syndrome, but it can also ramp up inflammation throughout your body. So this is a very big key to improving your overall health. Once this is all established, a specific program of supportive nutrients and diet are put together that is based on your history exam and clinical results, and we put you on a biomedical program. Sometimes heavy metals need to be identified through specialized laboratory tests. Once identified, they need to be chelated or removed from the body. that also helps in the healing. Conditions that will respond to a natural biomedical approach are many. Fibromyalgia, fatigue, and myofascial disorders, such as headaches and migraines, chronic back pain and chronic neck pain that never seems resolved, arthritic changes of the joint, or rotator cuff disorders of the shoulder. All these can be helped by a biomedical approach. Also brain health issues, ADHD, learning and behavioral problems, autism and Asperger's syndrome, depression, anxiety, and mood disorders, mild cognitive impairment, and even early memory loss. All will respond to addressing underlying biomedical or metabolic issues through a biomedical program. So, when so many have improved, what are you waiting for? Call the clinic today at 763-862-7100. That's 7100. And find out how easy it is to get started on your biomedical approach to true and real healing. Thank you.